Dr. Anthony Fauci, CDC Director Rochelle Walensky, and other top health officials testified before the Senate Health Committee Wednesday about the monkeypox outbreak. Senator Richard Burr specifically asked about the reasoning behind a report that some monkeypox vaccines might be saved for a possible outbreak of smallpox. Burr asked Don O'Connell, the Assistant Secretary for Preparedness and Response, what message this sends to, quote, the at-risk population when you suggest to them that though they are in the midst of an infection problem, that we are discussing holding back in case we have an outbreak of smallpox.
Senator Burr.
Thank you, Chair. Tony, last time you spoke on monkeypox here, you made it very clear that monkeypox is a result of animal to human transmission, and that happened abroad. Here's my question. If we allow monkeypox to circulate in our population indefinitely in the United States, what are the chances, and has it been studied, whether there can be a transmission from human to animal in the United States where we could have a threat that's animal to human transmission then that's domestic?
It's certainly possible, Senator Burr. Whenever you have a situation where you have an animal reservoir and the virus has already shown you from the standpoint of transmission that it can infect animal species, and you actually have an individual who is infected, there is no real reason why that not could go the other way. I don't believe that we have seen that, but I would not be surprised if we do see essentially going back and forth. That is possible.
And that would present a real problem.
Well, that would present a problem of the propagation. I mean, when you want to eliminate an infection, I mean, there's eradication, there's elimination, and there's control. The best way to eradicate or eliminate it is if you keep it out of the realm of an animal reservoir, which continues to refeed into the human population.
Great, thank you. Dawn, news outlets have recently reported the administration's evaluating whether some doses of Jynneos should be held back in the stockpile to meet our requirements for smallpox rather than distributed to support the current monkeypox response. This seems to conflict with FDA's recent decision to implement dose-sparing strategies, which indicates that we need to maximize the number of available doses. Can you square this up for me?
Thank you, Ranking Member, for that question. So we continue to maintain our smallpox preparedness. That's critical. Our frontline vaccines continue to be available and have not been impacted by our monkeypox response. But we have added the capability to be able to provide the Jynneos vaccine to those that are immunocompromised in the case of a smallpox outbreak. And we are evaluating with each dose that we make available to the monkeypox outbreak what it means for that preparedness in smallpox. I've met with the FEMC, I've consulted with them to understand whether we need a separate monkeypox stockpile so we can pull those vaccines off the shelf and not worry about the preparedness for the immunocompromised in a smallpox outbreak.
Have you ever thought about the message you send to the at-risk population when you suggest to them that though they're in the midst of an infection problem, that we're discussing holding back in case we have an outbreak of smallpox? Now, let me just explain. We know that we have 13 to 15 million gay men in this country, in the United States. Tony, we have about 1.9 million HIV/AIDS positive gay men. There's your immunocompromised population, 1.9 million. Your risk pool for sexually transmitted monkeypox about 13 to 15 million. And somehow we're cheering the fact that we put out 700,000 vaccines. If I'm in that community, and then on top of that, we have the subdermal decision, I'm going to cut the amount that you get, and there's not sufficient public, transparent information about that, you've got a population that's a little bit questioning whether you're doing everything to help them. And that may be a reason that we've only had 461,000 people vaccinated out of a pool, a defined pool of up to 15 million people, of which 1.9 million are immunocompromised because they're HIV positive. Dr. Califf, currently the FDA, I'll switch gears just real quick. Currently the FDA authorizes COVID-19 vaccines and antiviral treatments to be purchased only by the federal government, prohibiting anyone else that's not government from purchasing these vaccines. I believe we all agree on the crucial role vaccines and treatments play in stopping and reducing the spread of the virus. So why must every dose pass through the bureaucracy of Washington before it reaches a patient? And why are we still restricting access like that?
Well, thank you, Senator Burr. I think it is, by the way, I'm glad you're fully functional after your recent surgery, and you're definitely spry. You're showing good evidence of that. So let me just say that, we have the vaccine. It's available. It's everywhere. You can just make your appointment and get it. And we expect that this will transition, as there's been much discussion, over the next period of time. But for right now, those are the rules under which we operate.
That's why plan is somewhat important. Mr. Chairman, just one last question for Dr. Fauci, if I can. Tony, the pediatric immunization schedule recommends 4 doses of polio vaccine before one reaches the age of 6 years old. With new cases of polio being detected in New York State, I'm wondering, do we know how long immunity for the vaccine lasts? To what extent is someone protected if they were completely polio vaccinated as a child?
It is not necessarily lifelong, but it is measured in decades and decades. So if a person has the full series of vaccinations, you could expect that they would be fully protected. The situation that we're concerned about are those who have either had no vaccination, like we saw with the case in Rockland County in New York, or individuals who have did not complete their full course. But if you have a full course, however, since it isn't necessarily lifelong, when a person goes into a zone where there's a lot of polio, you would recommend that they would get a boost. But I would refer to perhaps that Dr. Walensky has something further to add to that.
I have nothing to add. That's
Right,
exactly
thank you.
where we are.
I thank the chair.